My name's Michelle Weiner. I'm an interventional pain management physician. I'm the chair of the Florida Medical Marijuana Advisory Committee, and I've been practicing cannabis medicine for the past 3 years. My research is actually using cannabis as a substitute for opioids in chronic pain patients. So we have about 200 patients that we've weaned off opioids using cannabis, have also seen this huge substitution effect, a lot of decrease in pharmaceuticals, and improvement in quality of life. So as we're practicing cannabis and we're moving forward, I see a lot of other patients besides pain patients, cancer, PTSD, anxiety, insomnia, and we're starting to learn about other natural alternatives. So the psychedelic renaissance is really upon us all, and as Dustin said, we have the option to do it in a responsible way. What the research shows, a lot of the research from Johns Hopkins, unlike cannabis where you take something every single day to help your symptoms, you can take 1 to 3 sessions of a high dose of psilocybin, for example, and it works on our serotonin pathways. It helps with basically finding a connection to source. That change of consciousness really gets somebody into a place where they're able to separate their trauma and separate the emotion from their trauma. And so they've seen that 1 year post 3 sessions of psilocybin, a patient doesn't even, 80% of the patients don't even have the diagnosis of PTSD anymore. End-of-life cancer patients who are suffering from anxiety at the end of their lives, 6 months later after 1 session, more than 80% of them don't have anxiety. And healthy subjects who actually use psilocybin, it shows that just 1 session of a high dose of psilocybin, healthy subjects, they report it's the most powerful, mystical experience of their life, even more so than having a baby, their own baby. So it really is a time for us who are so frustrated with Western medicine and the amount of pharmaceuticals and side effects. And right now, the only legal non-Schedule 1 medication that's similar to a psychedelic is ketamine, and that's a dissociative analgesic. And so we use that in infusions. I do that. I had 2 patients this morning, actually. I have a psychotherapist come in. They have sessions with the patient while they're using ketamine so that they're able to work on guided imagery and meditation in that other state that maybe others can't get into, such as meditation. And there's plenty of research from Harvard about what meditation can actually do in terms of neuroplasticity, rewiring our brain and changing the way that we think. And so these experiences really translate into a change in the entire society, where we have compassion and where we're able to really enjoy quality of life. And so it's just something that we should look into in terms of how to manage what is about to happen, where people are basically self-medicating the way that they were with cannabis, and now we can do it in a safe way with guidance and supervision.
Great.
Thank you.
Thank you for sharing your knowledge.